it's Ashley, Autoimmune Warriors. I am back at you today with another Makeup and Maladies. I'm super excited about this series. I love makeup. It's very therapeutic for me. And I love and have a passion for autoimmune diseases. I suffer from many, and I like to talk about them and educate people who either are suffering from them or have a loved one who's suffering from them. Breathe. And I like to share that information with you guys. I am not a doctor. I am not giving medical advice. I am just sharing knowledge and information that I either had from experience or Googled. So if you are interested in learning about autoimmune diseases and how they affect people, please give this video a thumbs up, subscribe, and click the little bell to be notified of future videos. Let's go. Today, we're going to be talking about diabetes, type 1, type 2, and type 1.5, which I didn't even know existed until I started researching. So type 1 diabetes is an autoimmune disorder that affects the pancreas. There are 3 types of diabetes. Like I said, type 1, type 2, and type 1.5. If you haven't heard of 1.5, don't feel bad, I hadn't either, but they're very similar and we'll get into that. So type 1 diabetes, if you didn't know, is the type of diabetes where your pancreas makes little to no insulin. Type 1.5 is basically a combination of type 1 and type 2 with a few other factors. Today, we're mostly going to be focusing on type 1 and type 1.5 because they're autoimmune related. Type 1 diabetes affects over 200,000 people in the US a year. Really common symptoms of type 1 diabetes are thirst, frequent urination, hunger, fatigue, and blurred vision. The treatments for type 1 diabetes are to mostly help maintain blood sugars. And they do that by monitoring your blood sugar, insulin therapy, diet, and exercise. And this is usually diagnosed in adolescence. Type 1 diabetes is usually diagnosed when you are a young teenager to young adult. It's important that when or if you are diabetic to follow something called a diabetic diet. And that is a diet specifically low in carbs and to help monitor or regulate your blood sugars. They may ask you to do something called nutrition counseling also, which will teach you the diabetic diet and help you to be the most successful as possible on it. Type 1 diabetes is considered an autoimmune disease because it results in the body destroying pancreatic beta cells. These are cells that help your body make insulin. Insulin is the hormone that helps your body process glucose, which is sugar. People with type 1 diabetes need to inject themselves with insulin to survive. So type 1 diabetes can cause damage just like all the other autoimmune diseases. And some of the complications are things like blood vessel damage, which is not good. And then you have things like neuropathy or nerve death, nerve pain. You can have eye damage. You can have foot problems. Skin and mouth problems. You can even have complications with your pregnancies. Type 1.5 diabetes is also known as an autoimmune disorder. It's also known as LADA, latent autoimmune diabetes in adult. The difference between type 1 and type 1.5 diabetes in diagnosis is the LADA is for adults. That is diagnosed in adulthood, where type 1 diabetes is usually diagnosed somewhere in your adolescence, early adulthood years, where the type 1.5 is diagnosed in middle adulthood, 30s. That's the main difference in type 1 and type 1.5 is when it's diagnosed, and 1.5, typically people that are diagnosed with that are overweight or obese, and that is really where the main differences lie. The symptoms are pretty much the same. So diabetes 1.5 can be triggered by damage done to your pancreas from antibody. I'm gonna look at this. Antibodies against insulin producing cells. So your pancreas gets damaged, and this can trigger an autoimmune disease. One of the factors for 1.5 diabetes is family history of autoimmune disorders. A predisposition to having other autoimmune disorders could make you at higher risk for having diabetes 1.5 in adulthood. When your pancreas becomes damaged in diabetes 1.5, the body begins to destroy beta cells just like it does in type 1. But like I said, the difference here is that the person is in adulthood and also is obese or overweight, where diabetes 1 doesn't have those requirements. I'm going to touch on type 2 diabetes real quick, just so you guys can kind of see the difference of what makes something autoimmune and what doesn't. So type 1 and type 1.5 have antibodies that are attacking the pancreas. Something triggers something and your body starts to attack itself. That makes it autoimmune. Type 2 diabetes, however, is when your body is resistant to insulin. This happens because of factors like genetics, but it mostly is affected by diet, inactivity, and obesity. This disease can be managed with diet, exercise, and medications. Sometimes type 2 diabetes does get severe enough where you need to inject insulin, but most of the time it can be managed with like lighter interventions like diet and exercise. So that's it for today. That is my Makeup and Maladies Diabetes edition. I hope that you guys enjoyed it. I hope that you learned something. I also used all of my makeup that I did out of my BoxyCharm box. I used that in today's Makeup and Maladies. So if you are curious about that, I will link that up above so you can go watch that video so you can kind of understand where this all came from, why I got it, and why I love it. Until next time, stay happy and healthy. I'll see you next week.